So when we're gonna apply the nasal interface to our little ones, we're going to have to determine what is the correct size. So on all of our different options, we have extra small all the way up to extra large. There is a sizing grid on the side here. And what this is showing you is the spread and size of the nares or the nostrils. And what we want to do is fit about halfway to 3/4 with this nasal interface, this super soft, pliable nasal cannula essentially. And that will allow for us to deliver the high flow. Oh, it's alarming. We're gonna hit our silence button, and this is just indicating that we're not at full temperature yet. So we would wanna wait for that. So these little dots, we will size like this. And we're going to evaluate, okay, those nostrils, those nares, I don't wanna fully occlude them, so I'm not gonna pick this size, but this next size looks just a little bit smaller. I bet that's what's gonna fit. So you're gonna remove your interface from the packaging, and on it, you see 2 super flexible, pliable cannulas, and then there are also these little wiggle pads, we call them. They're sticky. They have a sticker backing. So after, right before you're going to attach it, that's when you're gonna actually take these tabs off, okay? So I always like to put this, for our itty bitty babies, I'll put it behind their head, but for the older kids, they have a tendency to wiggle like this, so if this is behind their head, it's gonna cause a little bit of injury. So for those larger kids, which this babe would be, I would put it in the front. Irregardless, you're going to measure before you insert this. Because if it is the wrong size, you don't want to have to have this adhesive applied and then have to take it off. So I'm going to measure. Yeah, that looks great. So now I'm going to go back and with the help of nursing and RT, I find that it's easier than one person trying to do it alone. Because, you know, our kids are sick and they're doing all kinds of crazy things. So I'm going to remove proximal to that nare, and I'm going to do the same thing on the other side. Okay. Now the septal area, we want to make sure that this piece is not right up against it, close but not pushing on it. You're going to know if it's pushing on it because there'll be some blanching. You're going to see some white. So we're going to insert here, attach here. Now we're going to hold, and you're going to take your outside tabs off and push, hold for a little bit, kind of massage that. Once in a while, our babies are kind of goobery, and if that's the case, we have some saline wipes that we could use to kind of cleanse the skin, let it dry, and then we would do the same process. In the event that our little ones have too many secretions, which they're going to have a lot, you may have to reapply this. However, you don't have to grab a whole new setup. You would just grab these extra wiggle pads. We would remove this interface, wipe the cheeks, make sure they're good and dry, and then we would be able to do that.